Hi, I'm here with Tracy Foster, who is in Queensland, Australia, and she is a midwife for over 30 years. She's a registered nurse and an IBCLC. And I'm going to ask Tracy a couple of questions. The first, I'll do them together, and you can give me your response. So, what are the most common yet often unnecessary interventions that you observe during labour and birth? And how do you see these interventions impacting breastfeeding?
Okay, so the most common thing that I see is health professionals disempowering women and feeling that they can't make choices about their own journey when it comes to birthing and breastfeeding. Often the health professionals I feel that I see in my practice are very quick to disregard the breastfeeding and the dyad between the mother and the infant. They try, I know in the hospital setting, they try very hard to do, or the midwives try very hard to do skin to skin and delayed cord clamping. Which is something considered here in Australia as standard normal midwifery care, but often that just doesn't happen. It doesn't necessarily need to be an emergency situation. It can just be that the person, whoever it may be that's facilitating the birth, has just forgotten and handed dad the scissors or the partner the scissors to cut the cord, and they've forgotten to check to see if it's stopped pulsating. And I think also people that aren't breastfeeding aware are not used to letting the baby find its way to the breast for that first crucial hour. And so there's often interruption, which the health professional may think that they're actually doing a good thing in trying to assist mum at the breast, but I have had reports of people literally trying to force the baby onto the breast, which if the baby had have been left, I'm sure it would have found its way to the breast like, how they would normally go.
Yeah, okay. Are there any things that you would share with families, like words of empowerment, while they're in labour, birthing, or related to breastfeeding, that you feel is really important?
Yeah, so I'm actually in a really good position because I work for myself. And whilst I don't have any visiting rights at any hospitals by choice, I work with another very empowered woman who actually is not a trained health professional, but she is trained in hypnobirthing. So a lot of the women that I work with have done hypnobirthing, and they're very well aware of their rights. And we have lots of conversations, if not myself, but me, all the antenatal education that she does, that we empower the women that if something's said or something's suggested or done, that they're to question that. And the most empowering thing, I think, for women that have done hypnobirthing is that they actually put a sign on the door, and the midwives working in the units really like this because I think it makes them think twice before they go into the room, but they put a sign on the door saying that the woman's hypnobirthing, and the space is really guarded and protected. And often those women, if the women are women that I've seen, I also link them with a student, and that student will follow them through the antenatal period, through their birth, and then the postnatal period. And the students that work with me do many hours of breastfeeding education with the women, so they know what is best practice, they know current research, they're always out looking for things to upskill their knowledge that they've got as student midwives, and they are really good at empowering the women to make really informed decisions and question choices that sometimes are not necessarily looking at the woman and her journey. It's more the health professional and their journey and what's going to be easier for them.
Okay. Thank you so much, Tracy. I really appreciate the information that you've shared, and I know those listening will also gain a lot of knowledge. Thanks again.
That's okay. Thank you.